10 minutes. I just lowered it, so.
Stay.
So when you hit set, it goes to the different things. So instead, if you hit set right now, it's got the
Stay.
timer, it's got the clock there, and then
Oh.
it's 5 minutes. So
Oh,
that, you know, you're
okay.
in that. And then when I hit it, it says CON, that's for contraction. It's on for 15 seconds.
Okay.
And then I hit it again, it says REL, that's for relax, that's for 30 seconds. And then the ramp is set for 3 seconds. And then this is the pulse width is, or the frequency is 25 hertz. The pulse width is 200 microseconds. You're not changing any of it. I'm just if you happen to hit through the set.
And it goes through all of this in that 5 minutes.
Yes.
Well, all that 5 minutes.
Michael, you know
is
what?
just
Lay
the time.
across his head so that he can't get up.
Yeah.
5 minutes. All that doesn't run. All that is a setting for the entire time. None of that
Okay.
changes. So what is it's gonna do
Ow!
over the course of 5
Get it.
minutes?
Yes, down.
You can let him sit up, Barbara. It's kind of
Kick
fun.
me
I
in
want to
the
go over it with
ribs.
you first, and then
Huh?
we'll set
He
it.
kicked
know.
me in the ribs.
Over the course of the 5 minutes, it's just rotating between on for 15 seconds, off for 30 seconds, on for 15 seconds, off for 30 seconds. That's all it's doing over the course of the 5 minutes.
Okay.
And so it's keeping, or the 6 minutes, you know, set it there. The rest of it, like if you happen to want to change the time, you're gonna have, like I said, if you hit set a bunch of times, it's gonna just start to go through all these things. You want to get to the point where you see the clock and the number of time.
Oh,
So when
okay.
you start it and you're gonna increase the time, you might have, and then you press the up or down arrow.
Okay.
Does that make sense? Other than that,
Yeah.
you shouldn't have to mess with
Mess with
these
anything
buttons at
else.
all.
Okay.
Because basically what will happen as soon as you turn it on, it starts counting and it starts
Okay.
doing its thing. So normally you're just gonna turn it on and start doing it. But when you wanna change the time, you have to kind of hit the sets.
Okay.
What I'll do is I'll write down all those other parameters, so if you kinda accidentally press a button
Okay,
and you didn't
okay,
mean to, you
yeah.
know where you gotta put it back
Right.
to.
Right. Okay, good. That's good.
And then basically, so these things, what turns it on is also the strength of it. So if I just turned it on in 1, it's gonna start, but he's not gonna feel anything. I'm not gonna do anything. So you could keep it at 1 the entire time, and it'd be pretty pointless. So
Okay.
what I'll do today is I'll figure out where he's getting a good contraction. So that will be a place where you kind of start.
Okay.
What sometimes we find is that at the beginning of the 6 minutes, or that just gonna eventually get to 20 minutes, maybe setting 3 is good. But then as he maybe gets used to it, maybe I need to increase it as we're going. And so at the end, it'll be at like 3.5 or something.
Oh, okay.
You have to have your hand on it and feel it and
Yeah.
see, do I get a contraction or do I not get a contraction? So it's not just put it on and let it go. You know, you kind of, it's not
Yeah.
hard to do, but
Right.
it's just sometimes, and what you might find
Yeah, pay
is
attention.
the past few times I've been doing it in 4 has been really good, but now I'm noticing I have to go up to 5 and 6. It could be that the battery needs changing, or it could be that it's getting too hairy and we need to shave it because we're losing that skin contact. So that's something to pay attention to. So when you always turn it on, you always just want to kind of turn it on to that one spot first, get yourself situated, and then slowly turn it up. You never want to kind of go because that's gonna shock him. It's not gonna hurt him or burn him or give him anything, but he's just gonna be like, whoa.
Yeah.
And so he's one who's probably gonna be pretty sensitive with it. So we want to be on the safe side. So what we'll do is we'll shave it area, and then you need some sort of coupling gel. You can use like aloe vera gel. Like, you know, if you got sunburn, you would put some aloe on you. So just go get some plain old aloe gel. They can get it, there's Rite Aid supermarket or whatever. And put that on as the spot and things. And then,
Remember that aloe gel?
I wrote it down too, but, and then you just wipe it off with like a baby wipe
Yeah,
or something
yeah,
like that. It's
yeah.
not a big deal, so, okay. Alright, so we need to do his left side, so we need to get him over.
Michael, get him over. Come on, Dennis.